Does it ever explain to you what those two numbers really mean when you hear 138 over 76? Most people hear it and immediately panic or shrug it off. But what if I told you that one number could silently be wreaking havoc inside your body while the other is more of a long-term warning sign? And the kicker is, for decades, doctors were actually looking at the wrong number for most patients. Today, we're going to unravel exactly what your systolic and diastolic blood pressures are telling you, and why ignoring either could cost you far more than you think. Stick with me, because by the end of this video, you'll know which number deserves your urgent attention and which one might just be whispering a warning you absolutely cannot ignore. Picture this. You're sitting in the doctor's office. The cuff inflates, squeezing your arm as your mind races. Then the words come out. 138 over 76. What does that even mean? For years, medicine didn't have a clear answer. Doctors treated diastolic pressure almost religiously, believing the top number, the systolic, naturally rises with age and isn't a big deal unless it spikes into dangerously high territory. The idea was that the number representing your heart at rest, the diastolic pressure, was the real reflection of heart health. But recent research has completely flipped that thinking on its head, and what we once assumed is no longer true. Let's start with the systolic number, the top one. This is the pressure in your arteries when your heart contracts, pumping blood out into the body. Imagine opening a faucet and seeing that sudden surge of water. That's your systolic pressure in action. As we age, our arteries stiffen, almost like an old rubber band that has lost its elasticity. This, combined with other common age-related risks, such as diabetes and valve issues in the heart, pushes that top number higher and higher. And when it gets too high, the consequences are anything but subtle. A high systolic number drastically increases your risk of heart attacks, strokes, and even permanent kidney damage. It's not just a number. It's a silent threat that grows each time it spikes. But what about diastolic pressure, the number everyone used to obsess over? That's the pressure in your arteries when your heart is resting, refilling, and preparing for the next beat. Think of it as the steady background pressure in pipes even when the pump isn't pushing. And while it might seem less dramatic than that surge of systolic pressure, its dangers are very real, especially for younger adults under 50. Persistent elevation of diastolic pressure can gradually weaken the aorta, the body's main artery highway, running from your chest down to your legs. Over time, this can create a dangerous bulge called an abdominal aortic aneurysm. And if that bulge ruptures, it can lead to fatal internal bleeding. Imagine inflating a balloon. The initial stretch is fine, but push too far and the walls give way. That's exactly what happens inside your body when diastolic pressure goes unchecked. So now you might be wondering, which is worse, systolic or diastolic? The answer is both, but for different reasons. High systolic pressure primarily threatens your heart and kidneys, while high diastolic pressure quietly endangers your aorta and overall vascular integrity. And here's a twist that will surprise most people. Even if you're on medication to control your blood pressure, it doesn't reset your risk back to normal. A 30-year-old with high blood pressure has about a 63% chance of developing coronary artery disease in their lifetime, compared to just 46% for someone the same age with normal blood pressure. Medication helps, but it's not a miracle cure. This is where lifestyle changes come into play, and why they're often more powerful than many people realize. Simple strategies like eating potassium-rich foods such as avocados and fatty fish, staying active to keep arteries flexible, managing stress, and getting enough sleep can move the needle dramatically. Even small, consistent changes can shift your blood pressure numbers and reduce long-term risks in ways that medication alone cannot. But there's a catch. Not all blood pressure elevations are lifestyle related. Some may be due to specific nutrient deficiencies or other underlying conditions. And that's exactly what we're going to explore next, because understanding the hidden triggers behind stubborn high blood pressure might just save your life. Imagine this. You're doing everything right: medication, exercise, diet, but your blood pressure refuses to budge. It feels like your body is betraying you, but there's actually a hidden cause that doctors sometimes overlook. What if the very thing your body is missing could explain why those numbers remain dangerously high. In the next segment, we're going to dive into that little known factor, how it silently drives your blood pressure up, and what you can do about it before it leads to irreversible damage. You're about to discover why some people seem to have perfect blood pressure effortlessly, while others struggle despite doing everything by the book. And the truth is far more fascinating and alarming than most people realize. So why do some people struggle with high blood pressure even when they're eating right, exercising, and taking their medications faithfully? The answer might surprise you, and it all comes down to hidden imbalances inside the body that silently sabotage your arteries. One of the most common culprits is a deficiency in key minerals like magnesium, potassium, and sometimes even vitamin D. These aren't just random nutrients, they're essential regulators of how your blood vessels relax and contract. Without them, your arteries stay tense, your systolic pressure climbs, and your heart has to work overtime just to push blood through a rigid system. And here's the kicker. Many people are deficient without ever realizing it because the symptoms are subtle fatigue, headaches, sometimes even mild dizziness, and most doctors don't routinely check for these deficiencies. But it gets even trickier. High stress levels can act like a hidden amplifier, taking an already elevated blood pressure and pushing it dangerously higher. Cortisol, the hormone released during stress, makes your arteries more sensitive and your heart beats harder, raising systolic pressure. Combine that with poor sleep, and suddenly your body is trapped in a cycle where the heart is constantly pumping against resistance, the arteries are stiff, and even your medications are fighting an uphill battle. It's like trying to push water through a hose with multiple kinks. The pressure spikes, the risk increases, and the system strains under constant load. Now, here's a part that's rarely talked about. The timing of blood pressure readings can be just as important as the numbers themselves. Studies show that morning readings tend to be higher due to a natural surge of hormones that prepare your body for the day, while evening readings can be deceptively lower. That means a normal reading in the afternoon might mask a dangerous morning spike that silently damages the heart and arteries over time. Many people take comfort in seeing numbers that look okay, but they're only seeing part of the story. And if you're not monitoring consistently, you might miss warning signs until it's too late. Another hidden danger comes from what's called white coat hypertension. That's when your blood pressure skyrockets in a clinical setting but appears normal at home. It sounds harmless, but research has shown that even these temporary spikes increase the risk of heart disease over years because the repeated surges strain the cardiovascular system. So if you've ever been told your blood pressure is fine at home but high at the doctor's office, don't brush it off. You might be in the early stages of arterial damage without even knowing it. Let's circle back to the numbers, because understanding them in context is crucial. Systolic pressure is still the main headline. It's the number that reflects the force of your heart pushing against the arteries and tends to predict heart attacks and strokes more accurately in older adults. Diastolic pressure, though often overlooked, quietly predicts the risk of structural problems like aneurysms, especially in younger adults. So when you hear a reading like 138/76, it's not just about whether it's high or low, it's about understanding which number signals immediate danger, which signals long-term risk, and what combination could silently be putting your life on the line. But here's where it gets really interesting. Modern medicine now recognizes that treating just the numbers isn't enough. Medications can lower both systolic and diastolic pressure, but if you haven't addressed the underlying causes like nutrient deficiencies, stress, sleep issues, or lifestyle factors, the risks don't disappear. In fact, your heart and arteries may still be under strain, silently accumulating damage that won't show up in routine checkups until a serious event occurs. This is why a comprehensive approach, one that includes nutrition, exercise, stress management, sleep, and targeted medical interventions, is absolutely critical. And the final piece of the puzzle, the one most people completely miss, is consistency. Blood pressure isn't a static number. It fluctuates throughout the day, week, and even year. A single reading doesn't tell the whole story. That's why home monitoring, Keeping track of patterns and understanding the factors that cause spikes are game changers. Because once you start noticing patterns like spikes after stressful meetings, late nights, or heavy meals, you can start making strategic changes that gradually bring those numbers down in a sustainable, long-term way. And trust me, this is where the real transformation happens. But here's the cliffhanger you don't want to miss. Despite all the knowledge we've just uncovered, there's still one hidden factor, something almost nobody talks about that can push blood pressure higher than anything else. The way your arteries themselves change over time. We're talking about arterial stiffness, inflammation, and early signs of damage that are invisible without the right tests. And the scariest part, this damage can start decades before you notice any symptoms, silently setting the stage for heart attacks, strokes, and aneurysm. In the next part, we're going to reveal exactly how this happens, why it's almost impossible to detect with routine checkups, and what you can do right now to reverse the clock before it's too late. Now, let's talk about the hidden danger lurking in your arteries. Something that can quietly escalate your blood pressure and put you at risk long before you feel anything. Over time, arteries lose their elasticity, becoming stiff and rigid, a process fueled by inflammation, oxidative stress, and lifestyle factors that most people never connect to heart health. Think of it like a garden hose left out in the sun for years. The plastic hardens, cracks form, and when water flows through it, the pressure spikes dangerously. Your arteries work in exactly the same way. Even if your blood pressure readings look okay at a glance, stiff arteries mean every heartbeat sends more force through your system, slowly wearing down your heart, kidneys, and brain. And here's where it gets particularly alarming. Arterial stiffness doesn't just raise systolic pressure, it also disrupts the delicate balance between systolic and diastolic numbers. This imbalance can make the top number skyrocket while the bottom number stays deceptively normal, fooling both patients and doctors into thinking everything is fine. But inside, the arteries are under constant stress. The heart is pumping harder than it should, and the risk of catastrophic events like heart attacks, strokes, or aneurysms quietly climbs. Imagine driving a car with worn-out shock absorbers on a winding road. You might make it through every day, but the risk of a sudden crash is always there. That's exactly the hidden danger your arteries are facing. So, how do you know if your arteries are stiff before it's too late? There are specialized tests, yes, but you can also look for early warning signs. Persistent high systolic readings, even in the absence of symptoms, headaches, shortness of breath, and even subtle fatigue after normal activity can all signal arterial stress. Combine that with lifestyle factors like chronic stress, poor diet, insufficient sleep, and lack of exercise, and you have a perfect storm that accelerates stiffness faster than most people imagine. But the good news? Your arteries are surprisingly resilient when given the right support.